Well, good afternoon, everyone, and welcome to the Ho-Chunk Nation Department of Health Public Health Virtual Education Series, Wazooki Wo'ehi, Family Conversations. My name is Renelle, Public Health Nurse, and I'm joined by Jamie, Public Health Worker Supervisor. We will be your hosts. Our Department of Health is guided by the vision of building a strong mind, body, and spirit together. Through this virtual education series, we hope to bring our communities together by sharing knowledge, strengthening connections, and encouraging conversations that support lifelong wellness. In public health, our commitment is to promote, prevent, protect. Each month, we partner with knowledgeable presenters to explore topics that support healthier individuals, stronger families, and thriving communities, while highlighting Ho-Chunk culture, resources, and services available for our communities. Today, we are pleased to welcome Lisa Peterson, optometrist at the House of Wellness, who will be sharing her knowledge on and expertise on eye health with us today. The presentation will last approximately 45 minutes, followed by a brief Q&A. Please use the chat function to submit your questions or comments throughout the presentation. Jamie and I will monitor the chat and share your questions with our presenter during the Q&A. If you prefer, you can also raise your hand and come off mute and ask the question yourself. If we are unable to answer every question today, we will forward them to our presenter and provide responses following this session. Today's presentation is being recorded and will be available on the Department of Health website and our Facebook page. Everyone, please join us in welcoming Lisa Peterson.
Thank you. Let me get this shared here for you. Okay, so as it was presented, my name is Lisa Peterson. I'm the optometrist here at House of Wellness, and we were asked for the optical department to do a talk today on healthy vision. So my presentation is Take Time to Care for Your Eyes, Tips for Healthy Vision, and this is kicking off, actually July is known for Healthy Vision Month. So my goals today are to kind of go over some tips and share with you also some common cases or common eye conditions that we see in clinic, as well as maybe you have discussions within your families or friends. And then at the end of the presentation, I kind of wanted to give you guys an introduction to the optical department with Ho-Chunk Nation and what we have to offer to our members. So, see if I can hear. Okay. So first thing, I just kind of wanted to just quickly introduce myself, my background. I'm originally from Ohio, so a lot of the educational background that you'll see here are schools that I went to in Ohio. I obtained my bachelor's in chemistry degree from a school called Baldwin Wallace College. It's outside of Cleveland, Ohio. And then I pursued my doctorate of optometry at The Ohio State University. And then after that, I decided to do a more in-depth educational training with an optometry residency in ocular disease through the Dayton VA Medical Center, which I gained a lot of insight for what I see today and how I can take care of my patients in the utmost manner. So as I kind of said, today we're talking about healthy tips or healthy habits to protect your sight. These are some of the main bullet points I want to go over today. Things that are very important is getting a regular comprehensive eye exam with a dilated eye exam. We promote in staying active and maintaining a healthy weight. We do want our patients to try to eat nutritious foods or take supplements to enhance their diet, because we know that healthy eating does help our eyes as well as our bodies. Quitting smoking is a big benefit for not only eye health, but also systemic health and just overall our mind, bodies, and soul in general. So we'll kind of talk about that. Controlling blood sugar, blood pressure, and cholesterol are very important in prevention of certain eye conditions and eye diseases. Knowing your family history. So I know some families don't feel as comfortable always kind of sharing with members about certain things that they're going through, but it is very important because a lot of things that do happen with our eyes or even just with your systemic health can stem from genetics. So we definitely recommend knowing your family history. And then the last thing we'll kind of go over is protecting your eyes from the sun and when you're outdoors. So to kind of start with, talking about a comprehensive eye exam, the recommended examination frequency, as you can see in the chart below, kind of giving you from birth to 2 years, it is recommended that babies are seen somewhere between 6 and 12 months old. That would either be with a pediatric ophthalmologist, or there is a program in every state called Infant C. That's INFANTSEE. It's usually by the Optometrics Association. So there's certain optometrists within the state that go through a specialized training program to actually give eye exams to kiddos within 6 and 12 months. So we do recommend that just as a baseline screening. And then definitely start kind of seeing kids between the age of 3 and 5 before they kind of preschool, kindergarten. Those are kind of the key years that we want to start catching anything with eyes, whether they need glasses or if there's maybe something going on with the eye alignment, or even seeing some diseases, at that age can be caught. So Ho-Chunk here, typically for myself at House of Wellness, and I believe the other Dr. Lundberg up in Black River, we generally feel kind of most comfortable seeing around age 4 and up. So we can try to see younger, but it's not always the most easiest for us. We would probably recommend, again, scheduling maybe below that 4-year-old range with a pediatric ophthalmologist. And then obviously kids that are between 6 and 17, definitely would recommend, having an annual eye exam, sometimes more sooner, depending on if there's any risk factors. But a lot of kids can have a lot of changes even quicker than a year, with prescription changes. So, we always kind of see kids annually, but then, we'll talk to the family that if they have any concerns that there's any change, the child squinting, headaches, please feel free to kind of bring them on in sooner. And then kind of once you get to 18 and older, like 18 to 40, about every 2 years would be okay. And then within that 40 to 64 range, every 2 years, unless there's a risk factor, again, that we're seeing something that needs to be seen annually. And then typically anyone 65 and up, we would recommend you come in once a year to have the eyes checked and kind of screened for any type of eye disease or conditions that need to be followed more closely. So at the comprehensive eye exam, what can you expect? Well, it's, important because we're kind of checking your eyes, as a preventative part of healthcare. Many eye and vision problems have no obvious signs or symptoms. So a lot of times we will see patients that haven't had an eye exam either ever or a very long time that should have been seen many years ago, or kind of thinking that, well, I can see, I didn't think I had a problem, but then there's unfortunately something going on with the health of the eye that wasn't affecting the vision, but should have been kind of caught sooner. So it is important to kind of come in routinely, even if you feel like your sight's fine and you're able to see without any difficulty. Just having the health of the eyes checked is very important. So again, that early diagnosis and treatment of eye and vision problems can help prevent any vision loss or any concerns down the line. So in my little table here, I kind of just gave some information on things that we do test for at a comprehensive exam. Again, getting the patient history, we want to check your vision, so kind of knowing how you can see for distance and near, color vision, pupil assessment. We do a visual field to kind of see how your peripheral vision is, how the eye muscles are working. We do check the eyes to see if any prescription is needed, and then definitely doing our health exam by checking the front and back of the eye is very important. And then depending on what we do see at the exam, doing additional supplemental testing can be done sometimes with doing like a more automated visual field test, photos of the eyes. We have a variety of kind of instruments we can use, or refer you to a specialist who may have other equipment that we don't, to kind of further evaluate those eyes if we do see anything of concern. I just wanted to make a note on the screen here that I put in red on the bottom, that just do note that vision screenings, like at your doctor's office, the schools give with maybe the Lions Club or even DMV, these are not comprehensive eye exams. We do hear that a lot of times from patients that, oh, I had my eyes checked, I was fine. I had it done at the DMV when I renewed my license. That's just kind of a quick assessment, and it's not really doing the full gamut of what you're going to get if you come in with an eye doctor for the comprehensive exam. So I just kind of wanted to make note of that real quick. In regards to the comprehensive eye exam, dilation is important, and kind of these are things of what to expect and what it does to your eyes. So it's a use of a special drop called a mydriatic, and it enlarges the pupil. These drops, once they're instilled in the eye, typically take effect within 10 to 15 minutes. But the side effects of the drops can last anywhere from 4 to 6 hours. The side effects that these drops do cause are some glare, light sensitivity, and it'll definitely cause your near vision to be more blurred because it relaxes the focus system of the eye. So in general, most people are okay to dilate when they're alone if you come to the exam. But if you do feel uncomfortable in any means, if you don't think that you would be able to drive, or if you think that it's going to, impair your vision to do, say, work after the exam, definitely plan accordingly, maybe bring a driver. You could always schedule the dilation on a separate day from the other examination parts that we talked about before here. But it is important to have at least your eyes dilated. Depending on the individual, we recommend every few years. If individuals have something of more concern that need to be monitored, like condition of diabetes or cataracts or concerns of any glaucoma risk, we definitely want to kind of be doing that dilation once a year. And then, the dilation is important because it helps us as the doctor to better examine the inside part of your eyes. When we don't dilate, we're just limited to whatever the size of your pupil allows us to see. So by getting that pupil as large as possible, it just opens and expands that window so we can better ensure that we're getting the best exam possible. So it definitely gives us a better view to evaluate the optic nerve, the retina, both centrally and peripherally, and especially peripherally with patients who are nearsighted. That's important because sometimes with nearsighted prescriptions, how your eye kind of grew and developed, that peripheral retina can be a little thinner and then put you at risk factors for things like retinal detachment. So that dilation is definitely important to have that assessed. Other things that it helps evaluate too with diabetic eye exams is if there's any retinal bleeding from the retinal blood vessels, and then checking the lens of the eye for cataract formation. So definitely important part of the exam, kind of listed there, things that it helps assess better is the cataracts, diabetic eye exam, new onset of flashes and floaters, glaucoma, and another condition that I haven't really kind of talked about yet, but will later on, is age-related macular degeneration. Dilation is safe. A lot of people get concerned that it's going to do something more damaging to the eye, and it doesn't. It's been around for years. These drops have been used for many years by many optometrists and ophthalmology. It is a safe thing to do. You're unlikely to experience any discomfort or inconvenience, but one thing I just wanted to note to kind of prepare people for is that the drops do have a bit of a sting initially when we use them, because they do have a stronger preservative in them that can cause that stinging to occur. But again, just know that this is going to give the most thorough eye health check by having the dilation done. So going into next is what's the importance of good nutrition? So healthy eating, especially foods rich in vitamins, antioxidants, and minerals, can help improve and protect overall eye health. Research has shown diets higher in omega-3 fatty acids, lutein, zeaxanthin, vitamin C and E, and zinc have all shown to help reduce the risk for age-related macular degeneration, and just kind of helping the overall health of the retina in the back. So I just kind of gave a brief list here of breakdown of some examples of foods that you can consider kind of putting into your diet. Leafy greens are definitely high in the lutein, zeaxanthin, so like your kale, spinach, Swiss chard. The fish, salmon, tuna, halibut's going to give you your omega-3s. Then your other vitamins, C, E, and zinc, you can see with the fruits, nuts, certain seeds, proteins, and things like that. So definitely important for your eye health to kind of have a good diet there. As far as nutrition, though, if you're unable to obtain a proper diet providing all the suggested daily vitamins or nutrients, could always consider taking a daily multivitamin or supplement. One of the most common ones, maybe that you've either talked with other people about or have seen commercials on TV, is a vitamin called AREDS 2 formula, and it's marketed for age-related macular degeneration. This is suggested for those that develop either early signs of macular degeneration or have a strong family history of that. These vitamins, the AREDS 2, have been backed by 2 long clinical research trials that spanned over 30 years. So they definitely have been shown to be proven to be beneficial. On the left there, I kind of just gave you the breakdown of what the AREDS 2 vitamins contain, or kind of recommended amounts for each of those vitamins. And there's all kinds of different products. As you can see, I kind of included some pictures here. There's iCaps, Preservision, Ocuvite, MacuHealth. Those are some of the most popular ones. I always suggest to kind of looking at the label on the back, kind of seeing how they follow the recommended amounts, which I listed in the table there on the left side. And then kind of getting into, just kind of staying active and exercising, kind of just helping the overall health of your body, helps your eye health as well. So staying active and exercises helps to reduce risk for certain eye diseases like macular degeneration again, helps also control obesity and other systemic conditions, and it regulates the blood sugar, blood pressure, and cholesterol, which are all very important for eye health and kind of preventing any complications or certain diseases from occurring. So just kind of take care of your general health, seeing your primary care provider at least once a year for your annual physical. Obviously more often if advised, if there's something of concern that they're watching or wanting to try to regulate. But again, just improving those blood sugars, blood pressure, and cholesterol to achieve normal range is just very important overall for your eyes and your body. All 3 of these conditions are big risk factors for eye complications and eye diseases. Diabetes, cholesterol can kind of target your retinal blood vessels and cause vein occlusions or artery occlusions in the eye. The blood pressure, as well as blood sugars and even cholesterol, can put you at higher risk for glaucoma. So it definitely just kind of all intertwines, knowing that it's just one big system kind of affects everything. So smoking's a big risk factor for our eyes, can definitely lead to vision loss and blindness. Smoking can put you at risk for 2 serious eye conditions. Again, kind of mentioning the macular degeneration. So those research studies that I mentioned before show that smokers are 4 times higher risk of developing age-related macular degeneration than non-smokers. And then smoking also contributes to cataract development, kind of clouding the lens of the eye, forming more blurred vision or even vision loss. So individuals who smoke are 2 to 3 times more at risk for developing the cataracts than non-smokers. So definitely kind of, statistics show, that if you can try to quit smoking or reduce smoking, it's just going to be beneficial overall for your eyes and your body. Other things that smoking can cause, obviously the smoke can irritate the eyes, kind of putting you at more risk for dry eye, making those eyes feel scratchy, sting, get kind of burny sensation, and even cause the redness to occur. And then it definitely increases vascular complications in the body and the eyes. Higher risk for patients with diabetes, causing diabetic retinopathy, which is bleeding from the retinal blood vessels. Can cause less perfusion or blood flow to the optic nerve, so increasing your risk for glaucoma development. And then does cause higher risk and complications in patients with thyroid eye disease or thyroid conditions. So a couple things just kind of want to mention. Did you know when pregnant, smoking can harm your baby's eyes? So a baby has 6 times more likely chance of developing bacterial meningitis as a child, which is the tissue around the brain can swell and cause eye infection and other vision problems. So definitely kind of taking note of that and kind of what it can do later on. If you're the smoker or secondhand smoke, smoking during pregnancy can cause premature birth, which leads to an underdevelopment of the eyes. and that's a condition called retinopathy of prematurity. So this definitely can lead to vision loss or even blindness because that retina is not developing properly. The blood vessels are kind of targeted. Sometimes it can cause bleeding in the eyes in these babies, and this really causes a whole slew of problems where unfortunately that's going to carry forward as they kind of grow and develop to become adults, and it's not something necessarily that can be fixed or kind of reverse the effects. So definitely important to know the effects of that. And then secondhand smoke is just as risky as firsthand. So definitely can lead to, again, some of those same vision problems and conditions that we mentioned before. Just kind of wanted to share with you, I did look into here at Ho Chunk Nation, they do offer a nicotine treatment service program. That's offered at both House of Wellness and Ho Chunk Healthcare Center. You could either talk with your primary care provider to be referred, or you can self-refer. It can be a one-on-one in-person visit, or if you prefer to do it virtually, they do have that option. It's a program that's designed for all persons who want to quit all forms of nicotine and or tobacco, including vaping. I also wanted to include that there is an American Indian quit line that you can see in the bottom left corner with the number. So that would be another option to kind of contact them if you wanted to look into their services as well. So then kind of going into the importance of knowing family history, it's really important because it's critical in detecting and preventing for both eye health and systemic health. Many serious eye conditions are hereditary. Family history can increase your risk 9 times more in developing a condition. So kind of knowing the history, being proactive, you know, for the physician in kind of screening the patient. So like for us as an eye doctor, it helps us perform specialized testing beyond the comprehensive exam, maybe at earlier stages rather than kind of what the standard guideline is. So kind of one of the most common ones that I can say are glaucoma and macular degeneration. We do have some more specialized testing that we can do to kind of further screen the optic nerve or the retina that's affected in macular degeneration. So kind of just knowing that family history, we can kind of just be more on alert to kind of screen these patients sooner. Also just, knowing kind of families often share not only just, DNA with each other, but sometimes also kind of knowing certain cultures and habits. So dietary habits, environmental exposures, and that too increase risk for patients. And just kind of, knowing your risks allows you to make more informed lifestyle modifications and decisions. So sometimes if maybe parents, grandparents, siblings that are going through something and knowing that that is a condition that can be higher risk for you potentially develop, maybe there's something you could do looking at your diet or, increasing exercise or whatever have you to kind of help prevent or lessen that risk of you yourself kind of getting that condition. And then kind of going over protecting your eyes from the sun. So we know the sun has really powerful UV light, ultraviolet, and the exposure significantly increases risk for damage to your eyes, which can lead to various eye diseases, again, including cataracts. The macular degeneration is another big risk factor. So kind of we always just promote and want our patients to be aware, wearing some type of sunglasses that are labeled, and a lot of the sunglasses do have labels on them, or if you're getting them through an optical, your optician is going to be able to help you with that. But you want to look for 100% UVA and UVB ray protection to kind of best give you that protection from the sun. Other options, either with wearing sunglasses or without, is wearing a hat. That always, with the brim kind of helps kind of lessen the amount of light kind of hitting your eyes. And then if you are outdoors, protecting, especially around the eyes itself, the eyelid area, being careful, mind you, that you're applying this just to the skin, but using kind of a broad spectrum sunscreen to kind of help protect that skin from any skin cancer risk. So then I was going to go into just some common eye conditions that, again, that we see in clinic. And just some common eye conditions that people may be talking with their family or friends about. Maybe someone was diagnosed with one of these, or just something you've seen on TV or a friend, that kind of thing. So I kind of want to just go over a few things with you on some of these, not kind of going into too detail, but we're going to first kind of just go over cataracts. Cataracts are an opacification or discoloration of the normally clear crystalline lens, which is inside the eye. Most common cause is age related. We're all going to get, unfortunately, I hate to say it, but we're all going to get cataracts at some point in our life, just due to the normal degrading amount of our proteins of the lens. So that does changes over time and cause some kind of yellowing and clouding of the lens. So that's the most common type, but other causes are from trauma, toxic. So some medications can cause that. One of the ones that I can think of off the top of my head is if you're treated with some type of steroid, either oral steroids or even some steroids used for like breathing conditions, the sprays in that too can be a risk for cataract development. You can get cataract sometimes secondary to other conditions that can occur in the eye, or other conditions within your systemic health can come and cause a cataract to develop. Other things like endocrine or metabolic, so due to different systemic conditions, including diabetes, again, cholesterol, those kind of things are common causes for cataract development. And then kind of again hitting the hereditary. So some families actually have genetic predisposure to early onset cataracts. And I'm talking like, we'll see like someone maybe 17, 18 or in their 20s, starting to show cataract development. That's something more along the hereditary cause. Just wanted to kind of note, so for Native Americans, they face a higher prevalence due to elevated risk of diabetes, environmental UV exposure, and systemic healthcare access barriers. So just kind of, making sure that you're getting in, and we're kind of having a complete eye exam again with that dilation to kind of further check the lens to see if there's any development, whether we need to monitor or if that needs to be addressed with a specialist. Very important to kind of have that looked at. So different types of cataracts can occur. So whether you knew or not, there's actually three main types. The most common type is called nuclear sclerosis, which I have a picture off to the top right. That's where the lens gets kind of yellow or brown, and it typically can blur the distance vision more than the near vision. But that's kind of the most common type. Then we go to the middle one, which is called posterior subcapsular. The picture on the middle right shows that. It's a plaque-like opacity that starts to form near the back aspect of the lens, kind of centrally. So definitely the posterior subcapsular is kind of the most visually impactful when these kind of develop and then start to kind of grow out. Patients are going to tend to have more visual concerns or visual blur and decline, say more than the other two cataracts that we're talking about today. So that particular cataract does cause also glare, more difficulty with reading, but definitely can affect the distance as well, depending on how large that backside cataract is forming. And then the last one, kind of on the bottom left there, is called cortical cataracts. These are kind of little vacuoles that could either form in the lens, or kind of radial spoke-like opacities, which you see in the picture there, that will start out in the periphery, and then they start to kind of grow in centrally towards the central part, which would be where you're kind of seeing out of your pupil, the visual axis. So these can develop on the back side and front side of the lens. If you kind of think of the lens, like we kind of use the analogy, it's kind of like an M&M. So there's a front side of that candy shell, back side of the candy shell, and then the chocolate in the middle. That's kind of how your lens is. So the cortical can develop on the front and back side. The posterior develops on the back side, and the nuclear sclerosis is kind of the chocolate middle. So just kind of give you an example of that. The cortical, again, gives a lot of glare concerns when light's hitting that lens with those radial spoking or vacuoles. It definitely can make things more difficult to see, especially when you're in a more lit situation like nighttime driving. Definitely a big complaint and patients have difficulty seeing with the headlights, especially the LEDs that a lot of the cars have nowadays. So then I wanted to go into another common condition called floaters. So floaters are small little specks or dots, or they can be described as cobweb-like shapes that drift across your vision. These are caused by tiny clumps in the vitreous. The vitreous is actually a jelly-like fluid that's inside your eye that kind of keeps the eye inflated and kind of keeps the retina where it needs to be. But these kind of vitreous floaters develop, and then, you know, while you're looking around, you're seeing the shadow of that material that's clumped up, and it's kind of creating a shadow, and that's what you're kind of noticing or describing as the floater in your vision. So causes of these are just normal age-related changes to that vitreous material. Again, unfortunately, we are all at risk for these as we continue to age. Inflammation is another cause. So if there's any type of inflammatory condition of the eye, that can cause floaters to onset sooner. With diabetes and diabetic retinopathy condition, if there's any bleeding in the eyes where the blood vessels are breaking open and bleeding, that can create little floaters to be seen as well. More concerning, a kind of really important situation, if the retina starts to tear or detach, you're definitely going to get floaters from that. What that does is it actually releases little pigment specks in that space, and you're seeing the shadow of the pigmentation that's floating around. So any new onset of that, you know, definitely needs to be looked at. And then sometimes certain eye surgeries and certain eye conditions. So like eye surgery, like common, if you had cataract surgery, sometimes patients start to get a little bit of floaters after the surgery until kind of things heal and settle down. That's kind of a common thing that we can hear from patients. But just to kind of be aware, certain eye surgeries can lead you to see a little more floaters. So risk factors for floaters: anyone age 50 and up, patients who are nearsighted, anyone who had any type of eye injury or trauma to the eye that can kind of shake up that vitreous material and kind of create those floaters to occur. Again, post-cataract surgery or complications post-cataract surgery, diabetic complications, and then any type of eye inflammation, you can start to see more floaters. So I just kind of wanted to make we kind of discussed this, especially with any of our nearsighted patients, but we as eye doctors definitely ask you to see one of us ASAP if any of the sudden occurs, if you have any sudden onset of increased floaters. I always kind of describe it, if you have a few, that's fine, but if you're seeing something like almost a snow globe effect in your eye, you definitely better get in. Anything where you feel like there's like a nonstop flashing, like someone's taking a camera and flashing it out in the periphery, that can also indicate a concern. Anything there you feel like anything's obstructed, like you're seeing a gray curtain or a blurry area that blocks part of the vision, and any kind of darkness on the sides or peripheral vision, definitely would want you to get in as soon as possible with an eye doctor for a dilation to rule out anything with the retina, like retinal detachment, retinal tears, retinal breaks. And the next condition is glaucoma. This is an eye disease that damages the optic nerve, usually caused by abnormally high pressure inside the eye, and can lead to irreversible blindness. So this disease is often called the silent thief of sight, because glaucoma doesn't cause symptoms, unfortunately. So again, I had mentioned this kind of earlier, where we've had patients maybe not ever seen for an eye exam or many years ago, and they were, well, I didn't come in because my vision was good. And then you look in the eyes and you see their optic nerve, and you're like, oh, this patient didn't have any symptoms, but they should have came in many, many years ago. So unfortunately, it again, just kind of saying how important it is to come in for a routine eye exam, even if you feel like you're having no visual concerns for seeing far or close. This particular condition is one of them that is better to catch earlier than later. The glaucoma can be caused by many, I want to say it can be caused by many different things, but the main kind of rule of thumb is, you know, related to eye pressure. And the most common is open angle, normal tension, acute angle, and ocular hypertension. So just to kind of go over briefly, when we are looking at your eyes on exam, we test the eye pressure, and the eye pressure we want to see is within kind of the mid-teens would be the best. We always get asked like, well, what should I be for my eye pressure? We kind of have to look at it per patient. So it's hard to give an answer. You need to be 16 or you need to be 18. It's just looking at the whole picture of family history, your pressures, and kind of how your eye looks on exam to kind of know if there's any more concerns that need to be tested. But even some patients who have what we would call normal range eye pressures can still develop glaucoma. So we can't just say like everyone needs to be within say 12 to 18 and you're fine. I mean, it's a little more complex than that. Um, the last one that I had on there, the ocular hypertension, what that truly means is that patients have high eye pressures. Doesn't always necessarily mean that they have glaucoma as well, but it can be a bigger risk factor. So we still kind of treat those patients like we would a glaucoma patient or a glaucoma suspect, where we want to watch them closely, do our testing to kind of check and just keep closer monitor so that nothing does develop of concern. So just kind of wanted to go over those four, but there are other types of glaucoma that can occur. Didn't want to really get into them. They're a little more complex, and I kind of just wanted to maybe save that for a different time. Risk factors for glaucoma, definitely, again, higher eye pressures are a risk factor. Risk of development is anyone age over 40, but definitely you have a higher risk over 60, so a 6-time increase in risk. Genetics, if there's any first degree relative, like a parent or sibling who was diagnosed with glaucoma, definitely have a higher risk factor that that can develop for yourself. Doesn't always necessarily mean that that's going to happen, but definitely we want to take note of that and be watching that individual closely. Race is another thing that certain patients, African, Asian, Hispanic descent, are more affected by this condition. Again, not everyone, but definitely there's higher research to show that those individuals are more affected and need to be watched closely. According to the National Institute of Health, Native American and Alaskan Native populations are a 40% higher prevalence of glaucoma. So we do see that in our clinics. Definitely want to do our testing and kind of monitor patients. And then if we feel like there's anything that needs to be treated, we would go ahead and discuss and do so. In regards to the workup, so getting a good history to assess all risk factors, including family history, that comprehensive eye exam with dilation would be important. We would document the optic nerve appearance. So we either do, I guess back in the day before we had all the nice technology that we have now, we would used to do drawings, but now we have the ability to take colored photos like you can see down at the bottom of the screen there. We do more formal visual field testing, which helps map out the peripheral vision, which is a picture I showed on the upper right side. That visual field testing is important because if there is damage going on to your optic nerve with glaucoma, that's going to affect peripheral vision before central vision. And that really is why a lot of patients aren't aware something's going on with their eyes or vision, because it is kind of extending far out first. And then as that disease progresses, you kind of get like a tunnel vision. Another thing that we assess is the cornea thickness, which is the surface of the eye. That's an instrument called pachymetry. So the reason that we assess that is when we are checking your eye pressures, we're actually checking against that cornea tissue and how the fluid in the back of the eye or the behind the cornea is kind of pushing. And we want to know how thick or thin that cornea is, and it helps us kind of know how accurate the reading of the eye pressure check was and what the risk factor would be for that maybe being higher and putting that patient at risk for development of glaucoma. And then the other thing that's kind of a newer test that we do is called optic nerve OCT. I have a picture of that in the bottom right side. That actually is really cool technology that came out several years back. It actually takes a photo of that optic nerve, has the ability to give us size of the nerve as well as thickness of the nerve fiber layer, and it has a normative database that it references and kind of lets us know how that patient references with their own data to that to know, is there any concerns of thinning or damage, kind of where those areas to be concerned would be, and kind of helps guide us then if we need to treat and what we would want our pressures to be down for treatment. Treatment options for glaucoma are kind of variable, but vision loss caused by glaucoma is not anything, unfortunately, that we can kind of regain. It's not reversible, and the early detection is very important. So coming in, doing the testing, kind of us as the physician doing all the due diligence of evaluating all aspects of the eye and the optic nerve are important, because then we kind of decide, which one of these treatment options would we most recommend. So kind of first line of treatment that used to be the most popular, or is still kind of the most common, is therapeutics. So there's a variety of eye drops. I kind of just put a picture in here of all the ones that are available, which there's different classes. How they target the treatment of lowering pressure of the eye are by either helping to reduce the amount of fluid that's made in the eye, or there's other ones that help kind of increase the drainage system. So that helps kind of regulating pressure so that we can kind of get the pressures down for that patient. So we definitely use those variety of drops for treatment. But then there's also laser treatments, which are becoming more popular. They were kind of first started back in the, I think, 70s, and then kind of dwindled down, and the eye drops kind of became more popular. But in more recent, within the last, I'd say 5-10 years, these laser treatments are getting back popular again, and they're actually kind of becoming sort of a kind of a first line treatment. So the laser is used to aim at the drainage area of the eye, and what it does is it kind of puts bigger holes. It's kind of like opening up the sieve so that the fluid can drain out better and regulate that pressure. So that's another option that we do look at. And then the last option is microsurgery, which there's different surgeries that can be done. Obviously, those are kind of used with more advanced conditions of glaucoma. And there's a few that are actually being offered now if someone is either a glaucoma suspect or a glaucoma patient and then needs cataract surgery, they can do a combined surgery at the same time for the cataract removal, and then put in these little devices that I put a picture here on the bottom that helps kind of regulate again, that fluid, and decreases the pressure for the patient. So the next thing that I was going to talk about is that age-related macular degeneration. This is a progressive eye disease that damages the macula, which is the part of the retina responsible for central vision, kind of giving you the sharpest vision. There's two types. The picture that I have on the left is representing the dry, which is more the early or intermediate stage. This is the most common form that we see, and it accounts for about 85 to 90% of cases. And then the second form that can develop is more the advanced stage, which is the picture on the right, is the wet macular degeneration. Again, less common form, but it definitely causes more severe and progressive vision loss when that occurs. Symptoms in regards to macular degeneration, early stages, often many patients don't have any symptoms. So it may not be more to the intermediate stage where they start to notice like things like straight lines, like patients might look at like even like a door or a window at home and be like, oh, there's like a kink or a bump in there. So they start to kind of see things distorted or wavy, start to get more blurred vision or fuzzy vision within the central area. A lot of times this starts to affect like their reading ability. So patients will have trouble with that and kind of complain, and then we'll see that they have kind of early stage macular degeneration. The more advanced stages, again, these are more visually significant, so they're going to have more difficulty like recognizing faces, seeing fine detail, really having a hard time with reading, developing these dark, empty blind spots in their central vision, which I kind of showed a picture there of the little girl where the normal's on the left and the right side showing you what an image of a macular degeneration patient might see. So it's more and more significant visual compromise and complication having that wet macular degeneration. Risk factors, anyone 50 and older have a higher prevalence or are higher risk, and then a higher prevalence is definitely those over 80. Genetics again and family history, so close family members, first degree, can put you at higher risk for development as well. So knowing that family history to get kind of screened or checked. Smoking, per research, has shown that it just kind of breaks down those blood vessels in the retina and puts more risk for the deterioration of the retinal structure, creating macular degeneration to occur. Diet and weight, so high diets and saturated fats and obesity kind of elevate the risk for development. Blood pressure, cholesterol, and heart disease, they're all linked as well to higher rates of development. Caucasians are typically the highest at risk for this condition, and it's not a huge incidence that we see in Native American population, but again, still need to kind of have those exams done to kind of check the eye health to make sure that there isn't any signs going on in the eyes that we need to take care of and watch closely of this particular condition. So diagnosis is made, during the comprehensive dilated eye exam. Additional testing that we do, even as simple as this little grid that you see, the white and black grid, it's called the Amsler grid. That is something that if we do see any early signs of changes with the retinal structure in exam, we would give the patient one of these to take home and kind of test their vision every few weeks so that they can kind of see if anything's changing and get in contact with us sooner to be, evaluated. And then the picture that I have on the right is of a OCT of the retina. So that gives a structural view of the retinal tissue in the macula area, the central area, so that we can kind of see what's going on with that degrading of the retinal structure and how it's affecting the patient's vision. Currently, unfortunately, there is no treatment or cure, or no, I should say no cure for macular degeneration. The only treatments that we can offer are to slow progression and manage the symptoms of the patient. These are the AREDS2 vitamins, which I mentioned before, more for intermediate or late stage macular degeneration. And then the other treatment is injections, which is for wet macular degeneration. These injections are called anti-VEGF or anti-vascular endothelial growth factor, kind of a mouthful there, but basically what they do is in this condition, there is a growth factor that's starting to develop out in the retina that's telling abnormal blood vessels to start to grow, and these blood vessels grow, but they start to leak blood and fluid, making the condition even worse. So these injections are targeted at those abnormal blood vessels to help stop the growth of those and prevent any further development, and then kind of reduce the fluid swelling and the fluid leakage that's going on from those. Those injections would be something that we would be getting from a retinal specialist. That's not something we do here at Ho-Chunk, but definitely we can screen, do the exam, manage, and then if needed, refer you to that specialist for additional evaluation and treatment. And then again, other things you can do for prevention is just stop smoking, maintaining healthy weight, exercise, watching the diet, again, eating, diet richer in leafy greens to get that lutein and zeaxanthin, and the fish for the omega-3s would definitely be beneficial. Or again, taking the AREDS2 vitamins is something that we do discuss with our patients. Next condition I wanted to talk about is diabetic retinopathy. Complications of diabetes caused by high blood sugar or longer duration of diabetes, which damages the retinal vessels. In early stages, a lot of patients won't have any symptoms, but eventually, if left untreated, it can be something that can cause severe vision loss, even blindness if left untreated. Definitely be proactive. Work with your primary care on blood sugar management. Seeing us as the eye doctor for your regular comprehensive eye exam with dilation, so it can be evaluated if any of this is going on. In advanced stages, you can get blurry or distorted vision. You can get an increase in floaters and spots, start to develop blank or dark spots in field of view. Vision can start to look faded or washed out, or colors can start to look different, and definitely can affect your night vision. Risk factors. So prolonged high blood sugars can cause the damage to those tiny retinal vessel walls. And over time, the blood vessels become blocked and then they leak blood, fluid, proteins, or lipids. And they can trigger also the growth of those abnormal blood vessels, just like we discussed in macular degeneration. So patients with diabetic retinopathy can also develop this. Anyone who's a type 1, type 2, or gestational diabetes is at risk. Longer duration of diabetes, the poor blood sugar control, if you have really high blood pressure, high cholesterol, and then some people develop, again, diabetes during pregnancy, so definitely needs to be watched closely. Per the National Institute of Health, I just wanted to say Native Americans can have the highest prevalence of type 2 diabetes in the United States, which is making it a higher risk for diabetic retinopathy. So again, just stressing the importance of, having your health checked with your doctors and coming in for your routine eye exams, dilating those eyes. I know dilatation's not fun for everyone, but it's definitely, again, very important part. Most effective way to prevent complications, tight blood sugar control, managing the blood sugar, blood pressure, and cholesterol, helping, working with your primary care doctor to manage those conditions, that annual eye exam. If needed, again, we would need to refer you in more moderate, severe stages of diabetic changes to maybe that retina specialist. Again, looking at doing those injections. Sometimes they do laser surgery. The laser surgery would seal off the leaking blood vessels or shrinking them to kind of prevent or stop the bleeding from occurring. And sometimes in really severe diabetic complications, some people have such a large amount of bleeding that goes on to that vitreous material that we talked about before, that they actually need to go in and surgically remove that vitreous and blood out of there to kind of help the patient see again, and then go in to tackle what blood vessels are leaking to kind of help that patient save their sight. I want to talk about dry eye real quick. It's a chronic condition where patients don't produce enough tears, or their tear evaporation is really quick, causing a poor lubrication to the surface. Patients will experience stinging, burning, redness, itchy, either gritty, kind of foreign body sensation, blurry vision, and then I wanted to just kind of note this real quick. So you can have watery eyes yet be diagnosed with dry eye. So your body kind of naturally defends itself. It produces reflex tearing to compensate for the dryness. If it didn't do that, then the body or the surface of the eye would not have the lubrication it needs, and the nerves would get really irritated and it would be very painful. So if you have watery eyes and you get told you have dryness, that's kind of the reason. But it's definitely a sign of possible dry eye syndrome. Causes aging, so tear production does decrease with age. Environmental factors like dry air, wind, air conditioning, heat, being on screen time, digital devices. Certain medications can cause dry eye to occur. The tear evaporation is due to meibomian gland dysfunction, which I have pictures here on the bottom showing that your oil glands are clogged, and that's not good because the oil glands need to be producing oil to your tear film to help keep the tears on the eye. So that's another part of the exam. That when we do our exam, we kind of look for this to see if this is contributing to someone who might complain of having more dryness of their eyes. And then other things that can lead to it is autoimmune diseases, thyroid conditions, fibromyalgia. Just certain systemic conditions can definitely also cause patients to experience dry eye. And then computer vision syndrome. So we're all on screens with most of our jobs, kids at school, just kind of doing it for fun at home. So it can cause eye and vision related problems from prolonged use of computers, tablets, and smartphones. You can get eye strain, headaches, burning or tired eyes, again leading to dry eye, loss of focus, blurred vision, double vision, and it could even then start to kind of affect other parts of your body, kind of causing neck and shoulder pain and discomfort. Treatment. So rule of thumb, we use 20-20-20 rule. So every 20 minutes, take a 20-second break and try to look at something at least 20 feet away to kind of reposition your eyes so they're not kind of locked in and staring at that screen. Other things you could look at doing is increasing font size, adjusting the screen brightness, Reducing glare by using an anti-glare coating if you have glasses, or adjust the lighting position from above you, maybe to the side or vice versa. Lowering your device at eye level or below. Making sure you're remembering to blink or use lubrication eye drops called artificial tears. Work on dry eye steps. So if you're diagnosed with dry eye, definitely working on your steps to kind of help improve lubrication. And then regular eye exams just to make sure your vision is best corrected and there's no other eye problems contributing. So I just wanted to quickly, if I have a few more minutes, do I have a few more minutes to talk? I think. So I wanted to introduce the Ho-Chunk Nation Optical Department, kind of just letting you know what we have to offer here. So I just kind of wanted to give you a quick couple photos here. So this is the optical department at House of Wellness in Baraboo, Wisconsin. Then I have a couple photos showing our exam room here and our additional optical testing on the bottom left side. Again, I am the doctor here at Baraboo. And then we have the Ho-Chunk Healthcare Center Optical Department in Black River Falls. Couple pictures of their exam rooms. And the optometrist up there is Dr. Rachel Lundberg. Couple more pictures of their facility. So each location does have a full-time optometrist. We also do have an optical dispensary so that you can select and order glasses and or contacts. We have optometry technicians that work with us that are trained to assist in what we need, as well as our patients. They help patients with frame selection, frame adjustments, frame repairs, and ordering of optical needs. We have currently 2 technicians at Black River Falls and 1 technician at the House of Wellness. And we recently added an optical manager who's Edwin White Eagle. He helps kind of us with all aspects at both locations, both for helping us as the doctor as well as the technicians on the optical dispensary side. So if you need to schedule a comprehensive eye exam, we would definitely ask you to contact the patient registration at either location to get you in. And then just to let you know, our optical dispensary is, trying to improve in kind of what we have to offer. So our goal is to provide more frequent and newer frame choices for our patients, trying to get the latest styles and brands. We're providing a variety of sizes, shapes, colors to try to meet the needs of our patients. If you have any questions, please feel free to call the clinics. They work Monday through Friday, 8 to 4:30, and they do close from 12 to 1 for lunch. These are some of the brands that we currently offer in our optical dispensary. We have Coach, Guess, Nike, Dragon, Converse, Columbia, Timberland, Ray-Ban, Michael Kors, Swarovski, Harley Davidson, Native Vision, and other ones that I'm not even mentioning here. So just definitely have a wide variety of brands. And then we also have a variety of lens options. I want to just kind of touch on a couple real quick ones. Anti-reflective coating, we offer that. That's a coating that helps with nighttime driving, reducing reflections on your lenses from headlights. Also can help reduce reflections from your computer screen or overhead lighting, and just really improving kind of the sight overall, and also helps if you're someone that needs to be wearing your glasses and you don't necessarily always like taking pictures with them on, having that anti-glare coating actually is beneficial because cosmetically it actually lets you see your eyes in the photo better. So that's something to kind of note. There's blue blocker lenses. These are a special material or coating that absorbs or reflects the high energy visible light before it reaches your eye if you're on computer screens or digital devices. So definitely can kind of help again with reducing eye strain. We offer polarized lenses, which are more sunglass that have a special filter to reduce glare and eye strain, and can be ordered either in prescription or non-prescription options. Or some people also like the option of a transition lens, which is activated by the sun as you go outside, and it darkens the lens material, providing 100% UVA, UVB protection. These lenses, just note, are ideal in the car because your windshield actually grabs most of that UV, so they're not activated. So they're more ideal for outdoor kind of tasks rather than when you're in the car driving. We do offer a wide variety of lens materials as well as lens types, so single vision, bifocals, progressive bifocals. special lenses for patients with occupational, so like someone who does just computer reading, individuals that might have trouble when they're reading, they feel eye strain. Those are called accommodative eye strain lenses. If you know or you are a pilot, they have pilot glasses specially designed for that, so you can kind of see straight and see the controls above you. There's a variety of tinting options that we offer, solid or gradient tints, as well as mirror coatings. I know some of those mirrored sunglasses are kind of popular these days. So couple of quick things on insurance. We do offer accept insurance here at the optical department. We have the Auxilian Elder Insurance. For them, glasses, frames up to $130 are covered, and lenses are covered 100% with a wide variety of options that can be ordered, including single vision, bifocal options, and tints, polarized, glare coatings, scratch coatings, and stuff. Or the individual can use that benefit and they get $100 per calendar year for contacts if they prefer. We have Auxilian employee coverage, so Ho-Chunk Nation members, they get $400 every calendar year for glasses and contacts, and then non-Ho-Chunk Nation members are $400 every 2 years for their glasses and contacts. We also accept forward help for Medicaid. They're covered 1 pair per the date of service. So it's a covered frame by the insurance. They offer single vision or lined bifocal in a standard plastic material, and you can get 1 remake per inside that date of service. And then children, the same, they get 1 pair with a covered frame. Single vision, they do cover a little bit of a better material called polycarbonate because that's standard of care for safety for anyone 18 years old and younger. And they do get that 1 remake. Unfortunately, Forward Health does not allow the patient to add on, upgrade, or bring their own frame to use. You have to use or purchase or select within their selection that they offer. And then the last is purchase referred care. They give kind of a variety. So they have $200 for plastic or poly for a trifocal, $175 for polycarbonate bifocal lenses, or $150 plastic or poly single vision. So that's another option within the optical department to use the purchase referred care for your optical needs. So sorry if I went over a little bit. I appreciate everyone's time. At this point in time, I could take any questions at all about the presentation today.
Gigi, Lisa, we do have one question. Are you able to share this PowerPoint with us? Can I send it out to the people who joined today?
Oh yeah, absolutely.
Okay, Deb, I'll make sure you get that. Does anybody else have any questions for Lisa?
Well, if anyone thinks of anything later on, please feel free to pass them along to me and I can answer and get back to you. But I thank everyone for your attention and thank you for inviting me today.
Thanks again, Lisa. I learned a lot today. I never would have guessed that pilots get special lenses for flying.
Yep.
So thank you to everyone who joined us today. We appreciate you spending part of your day learning with us. As a reminder, today's recording will be posted on the Department of Health website and our Facebook page for anyone who would like to watch it again or share it with others. We hope you will join us for our next virtual education series on Wednesday, July 15th, featuring the Ho-Chunk Nation Department of Education. You can use the same WebEx link for every session in this series. If you would like to add the recurring calendar invite to your calendar, please send Jamie or I an email and we will be happy to forward it to you. Before you leave, we would greatly appreciate your feedback. Please take a few moments to complete our evaluation by using the survey link in the chat. If you have any additional questions or suggestions for future topics, please reach out to Jamie or myself. We will also place our email addresses in the chat. So thanks again, and we look forward to seeing you at our next session.